you. Well, good morning. We're so glad you're here, and we love seeing the yellow shirts again with the Committee to Preserve Social Security and Medicare. Your voice on an ongoing basis is so important. So thank you so much for all being here. And I want to thank Senator Ron Wyden, who is our ranking member and leader on the Finance Committee, which is so critical to everything that we are talking about, and Senator Shaheen, who is a leader on health care and has been a strong voice for protecting and preserving our health care and certainly coverage for prescription drugs, which we want to emphasize today. But we're here today because, unfortunately, health care is at risk again. It's unbelievable that we have to keep coming back over and over again to talk about another way that the administration and Republicans are trying to repeal the Affordable Care Act. They weren't successful legislatively, and so now they're going through the courts. And in just a few days, the Fifth Circuit Court of Appeals will hear arguments in Texas versus the United States. This is a case, a lawsuit brought by 18 Republican attorney generals and Republican governors, strongly backed by the Trump administration. Normally, if there was a lawsuit against a federal law, the president and the attorney general would be on the side of the people in the federal law, but they've chosen not to do that. They've chosen to be on the side of those that are bringing the case. And so this case, if it is upheld as it moves through, would completely repeal the Affordable Care Act. So we're here today because Democrats believe that health care is a basic human right, a basic human right. This is not political. It should not be political. This is personal for every single one of us and our families. And we believe strongly that people should be able to afford the medications they need in this great country. Meanwhile, Republicans have voted more than 100 times. They've voted more than 100 times to repeal or undermine the Affordable Care Act. There are many provisions that are so important with the Affordable Care Act that have made real difference in people's lives, making sure that someone who has a pre-existing condition doesn't lose their insurance, that they can buy insurance like everyone else to be able to cover their health care needs, allowing young people to stay on their parents' insurance to age 26, guaranteeing coverage for mental health care, addiction treatment, maternity care, all part of the basics for families when we talk about health care. And importantly, closing the gap on Medicare drug coverage for seniors. So let's be clear. If the gap reopens, or what we've affectionately called the donut hole in the past, seniors, including Pam Parker, who's with us today, will face much higher drug costs. People at any age will face much higher drug costs if this happens. I know that Pam's going to talk about how she can't afford that, our families can't afford that, our children can't afford that, and we as Democrats are going to continue to do everything we can to protect Americans' health care and lower the costs of prescription drugs. The Republican war on health care has got to stop. I want to turn this over now to Senator Shaheen, who really has been a leader in this effort to protect our health care.
Well, good morning. Thank you all for being here, and thank you very much, Senator Stabenow, for those important words. As Senator Stabenow said so well, Americans are just sick and tired of having our health care threatened every month by this administration. And time and again, the public has spoken out loud and clear to say, we want to ensure that we get health care when we need it. In New Hampshire, where substance misuse is a huge challenge, we have the second highest overdose death rate in the country now. And the way people with substance use disorders are getting treatment is through the Affordable Care Act, through the expansion of Medicaid. If that goes away, the treatment that thousands, literally thousands of people are depending on, that goes away too. And there is no plan B for this administration for what they're going to put in place of the Affordable Care Act. And what we have seen from not just our older citizens, but from everyone, is that the costs of prescription drugs are increasing every year. They're driving up the costs of health care, and if the Affordable Care Act goes away, the reductions in that gap that provides coverage for prescription drugs for older Americans, that is going to open again, and people are going to pay more. For seniors on Medicare, repeal of the health care law threatens to send them back to the days when they'd have to cover 100% of their prescription drug costs after reaching that arbitrary coverage limit. And in New Hampshire, the current Affordable Care Act and the savings because of the closing of that gap is more than $1,100 a year per senior. If you look at the whole year and what seniors are saving in New Hampshire, it's $106 million a year to the state as a whole from the effort in the Affordable Care Act to close that donut hole. So it would be an enormous step backwards if the Affordable Care Act is overturned and people again have to pick up all of those costs for prescription drugs. You know, last week I had the opportunity to sit in on a hearing in the Committee on Aging that Senator Collins was doing. And we heard from the director of the Center for Drug Evaluation and Research, who was talking about how important it was that we had set up a path for biosimilars that was reducing the cost of biologic drugs. That the biggest reason why those costs were beginning to go down, they had been the biggest driver of increases in costs for prescription drugs under Medicare, and the biggest reason that they were beginning to go down was because of this biosimilar path that had been created. Well, she said it had been created in 2010, but she didn't go on to say that it was created in the Affordable Care Act. And when I asked her, you know, well, what happens if the Affordable Care Act gets struck down? Does this path for biosimilars to create new drugs that can compete with the biologics, does that go away? And she gave me some, well, I don't know, I really haven't studied that kind of answer. But what she didn't say is that, yes, that does go away, along with the rest of the Affordable Care Act. We cannot afford this in the United States. We need this law to cover all of those benefits that Senator Stabenow talked about, and probably at the top of that list is the cost of prescription drugs. So thank you all very much for what you're doing, and I'm delighted to be here with Senator Stabenow and Wyden and to talk about what will happen if this law goes away. Thank you, Senator Wyden.
Thank you, Senator Shaheen, and my colleagues have said it so well, and Ms. Parker is going to say it better than anybody in the Congress can say it, because we just learned about what the benefits of health care are all about. Or not very long ago, I believe I heard it right, she received a kidney, and look at how well she is doing today. What a phenomenal success story. So what I'm going to do for a minute, because Senator Stabenow and Senator Shaheen have said it so well, is just offer up a few basic facts with respect to where this administration is on prescription drugs. First of all, the president does not have a plan to bring down these costs. Instead, a big chunk of what he wants to do would actually jack up prices for our people. Now, next month, with the support of his Justice Department, you're going to have this band of lawyers, this merry band of far-right lawyers, representing far-right governors and states' attorneys general. They're going to stand up in a federal court and attempt to basically throw the whole Affordable Care Act in the garbage. They're going to try and say it's unconstitutional. We shouldn't have it. So what I'm going to do just for a couple of minutes is make sure everybody understands what that means. First, if they were successful, you would be saying in this country goodbye to the Affordable Care Act provisions that stipulate that there have to be basic consumer protections in the plans that insurance companies offer in the Affordable Care Act that cover prescription drugs. That's number one. Number two, you'd see enormous number of people, and there have been a variety of studies done on this, shunted into what are called junk plans, junk bargain basement plans that don't cover the medicines that they need. And I will tell you, I thought we turned the lights out on junk insurance plans a lot of years ago, because Senator Stabenow was on the Finance Committee. She heard me tell the story, I'm sure, several times. When I was director of the Gray Panthers, the senior citizens group, people were selling the seniors 15, 20 policies, not worth the paper they were written on. And we thought we turned the lights out on them and got rid of them. And now, if the Trump people are successful, they're going to, as a result of striking this down in court, they're going to bring back the junk plans, and we're going to fight that in every way we can. Fewer than 1 out of 3 of the junk plans would pay a cent to cover prescriptions, according to the Kaiser folks who do some very good surveys. Second, expanded Medicaid coverage under the Affordable Care Act would be gone. So that's millions of people kicked off their health care, again, with no insurance to cover their medicine. That Medicaid coverage includes life-saving drugs, for example, to help with an opioid overdose, long-term addiction, Narcan, naloxone. I mean, these are real consequences in terms of what my colleagues just said, in terms of actually reducing prescription drug coverage if this Trump crowd is successful. And finally, the key reforms to Medicare that brought down drug costs for the senior citizens would be thrown into the dustbin. What that means is millions of older people would pay more out of pocket for their prescription drugs. So the bottom line is, as long as Donald Trump and his administration back this lawsuit, this flawed, misguided, mean-spirited lawsuit, they're basically working overtime to raise prescription drugs in America. And everything else is political doublespeak. And that's why we so appreciate everybody coming. And I was just so pleased that Ms. Parker would be with us here today. Ms. Pam Parker, who's going to tell a story that sure gives you a little bit of faith in what happens if you can actually get some health care. Quaint idea, huh? In the richest industrialized country on earth, where we spend $3.5 trillion, the four of us think, you know, you're spending $3.5 trillion, people ought to get some health care. So, Ms. Parker, please.
Good morning. Thank you, Senator Stabenow, Senator Shaheen, and Senator Wyden for drawing attention to a life and death matter that the Supreme Court will be considering in July. My name is Pam Parker, and I'm a member of the Alliance for Retired Americans. I'm 57 years old and live in Silver Spring, Maryland. I had a kidney transplant this past Mother's Day. I'm grateful to be able to speak with you just 5 weeks after major surgery. My health is so much better, but my worries are not over. For many years, I worked as an electrician, helping to wire the Holocaust Museum and the Pentagon until my health slowed me down. I began working as a researcher, but in 2014, I could no longer work due to my failing kidneys. I had to go on disability. I've had diabetes for more than 30 years. I also have high blood pressure, and my doctor says that it's what caused my kidneys to fail. I underwent dialysis for several years until my transplant on Mother's Day. I'm one of the lucky ones. I have a new kidney and a great prognosis. I have medical and prescription coverage under Medicare before turning 65 due to my disability. I also have supplemental insurance coverage, meaning that my out-of-pocket costs are relatively low right now. The retail price of my medicines is more than $6,000 per month. That includes $3,500 a month for the anti-rejection transplant medicines and $1,400 a month for my insulin. By the way, I remember when insulin cost $25 a month. I'm terrified of the high drug prices I will face if the Affordable Care Act is struck down in the courts and the Part D donut hole is reopened. I truly do not know what I'll do if that happens. And I know I'm not the only one. Eliminating the donut hole is important to all retirees who are more likely to have multiple health conditions and take more medicines. We worked hard all our lives and earned our Medicare. Please do not take this earned benefit from me and my fellow Americans. Thank you for listening.
Bravo.
Thank you so much,
you.
Pam.
Thank you.
Thank you so much, Pam, for your, you know, when you were saying $6,000 a month, if my math is right, that's $72,000 a year. And unfortunately, those prices have been going up. The last year that we have been able to measure the rate of inflationary increase in 2017, the average prescription drug went up 4 times higher than the rate of inflation in 1 year. So think about this. It's $6,000 a month now, but who knows? So that's why we're here, and we're happy to take questions. We are a country where, because of public investments through the National Institute of Health, as well as working with the private sector, we have great innovation, new opportunities for new medicines. But frankly, when it gets to pricing it, I believe it's the most rigged system that we have, because every effort is made by the industry to stop competition from biologics and to do things that will keep prices high. And we see the fastest growing driver of healthcare that is uncontrollable is the cost of medicine. So this is a big deal, and if the Affordable Care Act is repealed, we will see it go backwards rather than forwards, and we need to keep moving forward to bring prices down. So, okay, great. Well, thank you very much, everyone. We appreciate your being here. Thank you.
Parker, thank you so much.